Welcome back at 7:14. This month marks National Diabetes Month. About 1 in 10 Americans live with diabetes, and it is the 7th leading cause of death in the United States. With us this morning with details on diabetes and how to treat and manage diabetes is Dr. Schuyler Williams, an internal medicine physician with Touro Health. Dr. Williams, good morning. Thank you for being with us.
Hey, good morning.
Dr. Williams, I think it is important, pertinent even during this Diabetes Awareness Month, to first discuss what diabetes actually is and the different types of diabetes that are out there.
Yeah. So diabetes, as you mentioned, is a very common chronic health condition impacting about 11% of the U.S. population, or as you stated, 1 in 10 Americans. It centers around having a problem in the way the body regulates your blood sugar. The hormone that's responsible for this action in the body is called insulin. So if you have diabetes, either your body is not making enough insulin to regulate your blood sugar, or your body is not making insulin at all. And so that's why in the major types we see, type 1 diabetes is marked by having an absolute deficiency in insulin, meaning the body doesn't produce insulin at all. Therefore, it's usually diagnosed early in life, and treatments do center around administering insulin. However, with type 2 diabetes, which is the most common type of diabetes in the United States, the body is making insulin. It's just not utilizing it properly.
And then, of course, there's also gestational diabetes too, correct?
Absolutely, yeah. Gestational diabetes is when a mother is diagnosed with diabetes during her pregnancy and has never been diagnosed with diabetes previously. It does put the mother at risk for developing diabetes down the line, but generally once the pregnancy ends, diabetes will resolve.
And Dr. Williams, I know there are lots of signs and symptoms to look out for, and then there are also people who are more at risk than others of developing diabetes, correct?
Yes, correct. So I'll start with symptoms. Often, a lot of people are asymptomatic, meaning they don't feel anything at all who have diabetes, which is why it's so important to be screened at your routine doctor's visits for it. But if you do have symptoms, the most common ones we see are an increased level of thirst, an increased hunger, in extreme stages, you can have blurred vision or tingling and numbness in the feet. It's really important to get screened, and particularly if you have risk factors. So for type 1 diabetes, these risk factors are a little less clear, but family history seems to play a very big role in it. Type 2 diabetes, however, you are more at risk if you're over the age of 45, if you lead a sedentary lifestyle, if you've had gestational diabetes, as I mentioned, or if you have pre-diabetes, and that's the precursor stage for diabetes.
Well, Dr. Williams, again, a whole lot more we can talk about as far as diabetes is concerned. We appreciate your time this morning, making people just somewhat aware during this National Diabetes Awareness Month.
Absolutely. Thanks so much for having me.